Thank you. That is a very nice picture of me without a beard many years ago. Okay, so Tiger Aesthetics. I'm Dr. Khorsandi. I'm Chief Medical Officer, also co-founder, and I developed AlloClay over the last 6 years, 7 years now almost, with Tiger Biosciences. So what is AlloClay and what's all this hubbub about it? But first you have to understand that the need in the market is for large volume in tissue, large volume and restoring volume, and nothing in the category, nothing that was out there except for autologous filled that need. AlloClay is intact adipocytes with a membrane. It is not living tissue. It provides immediate volume, and it has ECM proteins that not only stabilize, they help signal, and they also support volume in injection. So it's the first structural adipose tissue designed for body contouring. It does have intact adipocytes, but they are not living. These are denucleated cells. They provide immediate volume, which provides immediate satisfaction for the patient. It's ready to use in the office. It's off the shelf, room temperature, room stable, for up to a year. And when it comes to our product pipeline, AlloClay is our first product in this category, which gives us volume, which I say below the clavicle, so breast, body, buttocks. But the real, I think, corner of the market that this will address is above the clavicles. In facial aesthetics, hands, areas where you need a more delicate volume, something with a lower viscosity, and that's DermaClay, which will be launching in 2027. So if you look at the numbers, we see a 32% increase in body procedures over the years. And the numbers of GLP-1 usage in the United States, which in some estimates are greater than 15 million patients, JP Morgan estimates it to be about 25 million by 2030. I think these numbers are grossly underestimated because so many of our patients are buying GLP-1s from the black market. And I can't tell you how many patients are on retatrutide right now, but it's a fair number. Who needs this type of product? The patients who have lost weight. And when you lose weight with GLPs, it's indiscriminate. You lose weight in your breast, your belly, your butt, your face. But where do we want volume? Our face, our breast, our body, our butt. Without something to replace that, patients are left with dissatisfaction. And the demographic that this goes after, the demographic of GLP users, are generally skewed towards women with a higher BMI, higher educational level, right, and an interest in plastic surgery. So of the patients who are interested in treatments that work for their body, most of them want something natural now. We are moving past the synthetic age of plastic surgery. So what are our options for body contouring today? We have autologous fat transfer, and we have HAs, which I don't really think are body contouring products, and some biostimulators, which if any of us have used them, any physicians are in the audience, they really fall short of the need. And here comes AlloClay. It fits into this matrix properly. So here's the disclaimer. It doesn't contain any viable cells, which I've repeatedly mentioned because there's a lot of misconception about that. It has no systemic effect outside the area that it's placed. It's not dependent on metabolic activity of cells. And the allograft is intended for a single use. There are other disclaimers like don't use it on your dog, and it's not for patients with severe allergies. But in the general purpose sense, this is a homologous use 361 product. All right? If you look at raw tissue, raw adipose, and you compare it to AlloClay, it looks similar. And if you do an analysis of what's in that vial, it's almost 90%, 98% fat, okay? Small amount of aqueous tissue or aqueous solution, so less than 2%, and less than 2% free oil. It looks very similar to autologous fat, but I will say it stands up a little bit fuller than what you would normally see in autologous fat, so it has a distension factor. And when we inject it, we see immediate contour changes. This is it being injected into a dish here, so you could see this does indeed look like fat. Anybody who's done autologous fat transfer understands that volume and consistency of volume is important. There are many products out there that try to remove any free lipid, aqueous portion of the liposuction to get to this point, but this is what it is directly out of the vial. And here's what the composition is. We have 60% adipocytes and 40% ECM. And this is as homologous as you can get with a human cell and tissue product. We have done our best to maintain homology, and we've done it through proprietary methods, right? It didn't happen overnight. It took many, many iterations of this, but what is in that ECM is also essential. There are other products out there that are purely ECM. In this product, we've done assays, proteomics, that show over 232 intact proteins, largely structurally collagen, elastin, and my favorite protein, which nobody really thinks about, which is laminin, right? What is laminin? Laminin is a signaling and attachment protein. It is so essential to the differentiation of stem cells because the protein signals themselves in the ECM may be able to take a stem cell to differentiate it into an adipocyte. But it's mechanicotransduction, which is a fancy word saying when that stem cell reaches its target, what does it feel in the environment around it? It doesn't have eyes. It doesn't really see anything, but it feels the environment, which is adipose tissue. The laminins, as you can see here, form a sort of landing pad that integrates the stem cell, allows signaling transduction to occur within the stem cell, and causes differentiation of that stem cell. But this is a naturally occurring ECM protein that in most processes is destroyed because it's a very delicate molecule. The proprietary difference with alloclite is that there is a lack of DNA. Using Crapo and Badalix and Gilbert's study from Pittsburgh on DNA concentration in human cell tissues for transplantation, they identified that below 50 nanograms per milligram of DNA is below the threshold for antigenic response. And when we looked at our product, we see that in Brightfield, there's no DNA. And in DAPI, which is a staining for double-stranded DNA, the DNA is absent. So this makes this product acceptable to any human being. Our animal studies show angiogenesis initiating at 1 month, peaking at 3 months, and arresting at 6 months. It's used for breast, body, anywhere contouring is needed below the clavicles at this time. And early clinical trials have been focusing on hip dips. This is a 1 month post-treatment with 50 cc's in each hip dip. And this is a patient that I've treated over the course of over a year with 4 different treatments, 200 cc's, 100 cc's, 100 cc's, and another 100 cc's for a total of 500 cc's for volume restoration following use of GLP-1. Thank you.